Dr. Dento. Promoting growth and professionalism. Hi guys. Our topic today is oral mucosa membrane. This topic quite lengthy. We are discussing about only basics of oral mucosa membrane. First we are discussing about definition of oral mucosa membrane. The moist lining of the oral cavity called as the oral mucous membrane, or oral mucosa. At the lips the oral mucosa is continuous with the skin, at the pharynx the oral mucosa is continuous with the mucosa lining the rest of the gut. There are 4 functions. First one is defensive. The oral mucosa act as an efficient barrier against the entry of microorganisms and also secretes antibodies. Second one is secretion. The secretion of salivary glands keeps the oral cavity moist and prevents the mucosa from drying and cracking. Next one is sensory. The oral mucus is sensitive to touch, pressure, pain and temperature. The sensation of taste felt only anterior 2/3 of tongue. Protection. The oral mucosa protects the deeper tissues from mechanical forces resulting from mastication. Our oral cavity consists of 3 types of oral mucosa. First one is masticatory mucosa. It comprised 25% of oral mucosa membrane. And it includes gingiva and hard palate. Specialized mucosa, which contributes to about 15% of the total area. This includes dorsum of the tongue and taste buds. Third one is lining mucosa, which contributes to about 60% of the total area. This includes lip, soft palate, alveolar mucosa, cheek and floor of mouth. Now for the descriptive purpose, the oral mucosa membrane is divided into keratinized mucosa and non-keratinized mucosa. Next we are discussing about components of oral mucosa. The 2 main components of the oral mucosa are stratified squamous oral epithelium and underlying connective tissue. This layer known as lamina propria. In this picture you can appreciate the epithelium and lamina propria. The epithelium and connective tissue interferes wavy unrelating, with connective tissue papilla interdigitating with epithelial ridge or pegs. This is connective tissue papilla and epithelial ridge. The junction between epithelium and connective tissue is called basement membrane, and referred to basal lamina by ultrastructurally. Now below the lamina propria is another layer of connective tissue is called submucosa. In some regions such as lip and cheek the submucosa present. But gingiva and hard palate oral mucosa is directly attached to the periosteum of bone without any intervening submucosa. This type of firm attachment is known as mucoperiosteum. Dr. Dento. For more information please visit Facebook page. Let's see about basement membrane in details. We already discussed the definition of basement membrane. It is the interface between the epithelium and connective tissue. Under the light microscope, this interface appears 1/4 micrometer thick and stains positively with periodic acid Schiff, and is termed basement membrane. Ultrastructurally, it is called the basal lamina and is made of 3 layers. A. Lamina lucida. B. lamina densa. C. Lamina fibroarticularis. In this picture you can see the basal lamina. This is basement membrane. Lamina lucida is a clear zone just below the epithelial cells. This is the lamina lucida. It is a 20 to 40 nanometer wide glycoprotein layer. And it contains type 4 collagen. And an antigen bound by the antibody KF1. Lamina densa is middle of 3 layers. It is a dark zone beyond the lamina lucida and adjacent to the connective tissue. Lamina densa contains type 4 collagen coated with heparin sulfate. This is the lamina densa. Attachment mechanisms are also part of basement membrane. These involves hemidesmosomes and anchoring collagens. Lamina fibroarticularis. It also known as sublamina densa. It is located adjacent to lamina propria and contains fine reticular fibers. In this picture you can see a clear zone. It is lamina lucida. Just below the lamina lucida a dark zone is present. It is lamina densa. This is anchoring fibrils. It forms loop and inserted into the lamina densa. Lamina propria. The lamina propria may be described as a connective tissue of variable thickness that supports the epithelium. It is divided for descriptive reasons into 2 parts, papillary and reticular. The papillary portion is between the epithelial ridges and the reticular portion is below it. The papillary layer is made up of finger-like projections of the connective tissue and contains loosely arranged, thin collagen fibers. The reticular layer is made up of thick collagen fibers which are arranged in bundles. And it contains fine immature argyrophilic reticular fibers. The papillary portion. The number, length, and width of these papillae vary in different parts of the oral cavity. In areas of masticatory mucosa, there is an increase in the length and number of papillae. Whereas in the areas of lining mucosa, the papillae may be short or absent. The reticular layer is also variable depth and always present in oral cavity. The ground substance is composed of proteoglycans and glycoproteins. In addition to mast cells, macrophages, fibroblasts, and inflammatory cells are seen. The extracellular matrix is composed of collagen fibers mainly of type 1 90% and type 3 8%. Small amount of elastic fibers are present, which do not form bundles like collagen fibers. The blood supply comes from the plexus of large vessels in the submucosa or from the deeper part of the reticular layer. In this picture you can see small capillary plexus between the papillary and reticular layer. From these, capillary loop pass into the connective tissue papilla, and it lie close to basal layer of epithelium. The main function of capillary plexus is provides nutrition for all layers of mucosa. Next we are discussing about submucosa. It is the connective tissue of varying thickness and density, which serves to attach the lamina propria to the underlying bone or muscle. The structure of the submucosa decides the nature of attachment, whether loose or firm. In some parts of oral cavity may be present or absent. The submucosa contains large blood vessels, nerves, and lymphatics. Adipose tissue and minor salivary glands are also seen in the submucosa. Hi guys. Next topic is most important topic. Epithelium. We already discussed two topics: lamina propria and submucosa. The epithelium of oral cavity is derived from embryonic ectoderm and is of the stratified squamous type. It may be keratinized or non-keratinized. Keratinized epithelium has 4 cell layers: stratum basale, stratum spinosum, stratum granulosum, stratum corneum. Nonkeratinocytes epithelium. This epithelium is composed of 3 layers, namely 1 stratum basale, 2 stratum intermedium layers, 3 stratum superficial. Ultrastructure of the epithelial cells. Cells of the basal layer are the least differentiated oral epithelial cells. They contain typical organelles, tonofilament and desmosome. Epithelial cells are called keratinocytes due to they contain tonofilaments. They form a bundle. It is called tonofibrils. This is the tonofilament. Chemically, the tonofilaments known as cytokeratin, which are present within the cells. This are the cytokeratin, and they're present at area of where 2 cells they joining each other. Next we are discussing about desmosome. The attachment of epithelial cells to one another is by desmosome. In this picture you can see circle or oval area. This is the desmosome. And also bundle of tonofilaments are inserted it. It consists of 3 components: 1 transmembrane molecules, 2 plaque, 3 intermediate filaments. Similarly, other groups of intracellular junction is called hemidesmosomes. It help to attachment of epithelial cell to connective tissue. Keratinized epithelium. Let's see stratum basale. The stratum basale or the basal cell layer is present adjacent to the basement membrane and consists single layer of cuboidal or columnar cells. Cells of basal layer are the least differentiated among the oral epithelial cells. Mitotic activity is prominent in this layer as new cells are formed here. All cells with mitotic potential can be seen with special stain, red stain. The basal cells are made up of 2 populations. One population is serrated basal cell. They are rich in tonofilaments along with pedicle. Its help in attachment of basement membrane. And other one is non-serrated basal cell. This small stem cell is only germinative. This is the non-serrated stem cells. And this is serrated basal cell. It also known as transit amplifying cells. The cell contains intermediate tonofilaments of 10 nanometer composed of keratins 5 and 14. Basal cells show ribosomes and elements of rough-surfaced endoplasmic reticulum. This indicated protein synthesis activity. Cell contacts in the form of desmosomes, hemidesmosomes, intermediate, and gap junctions are present, allowing for adhesion, cell signaling and other functions. Second layer is stratum spinaceum. This is the stratum spinaceum or spinous cell. You can see this layer located above the basal layer, and is made up of several rows. The shape of spinous cell is polyhedral. Of the 4 layers, the spinous cells are the most active in protein synthesis. The intracellular spaces contain glycoproteins, glycominoglycans, and fibronectin. On light microscopy, cell are joining by intracellular bridge. On electron microscopic appearance, the intracellular bridges are desmosome. Pickle cell layers under light microscopy showing the intracellular bridges between the cells. And under the electron microscopic, you can see numerous desmosomes holding the cells, and tonofilaments are inserted into the attachment plaques. During tissue preparation, the cells shrink away from each other and remain in contact only at points. The point is desmosome. This gives the cells a spiny appearance. The tonofibril network and desmosomes make up the tensile supporting system for the epithelium. The third layer is stratum granulosum. Stratum granulosum is composed of flatter and wider than spinous cells. Cells arranged in 4 to 8 layers, and the cells proteins are still synthesized but at a reduced rate. The nuclei show signs of degeneration and pycnosis. Cell contains basophilic, electrodense keratohyalin granules, which give the surface a grainy appearance. In this picture you can see the granules. It is irregular in shape and also associated tonofilaments. Keratin 1, 2, 10, and several other proteins synthesize like profilagrin, involucrin, loricrin. In this picture you can see membrane-coating granules that are present in the upper part of the spinous layer, and the granular layer are called the keratinosomes or Odland bodies. These lamellar bodies contribute to the formation of the permeability barrier between the granular and cornified layer. The topmost layer is stratum corneum. It is made up of keratin. The cells of this layer termed squams. You can appreciate in this cells are filled with tonofilaments. But another cellular organelles and nuclei are absent. We already discussed the cornified layer is formed by densely packed with tonofibrils and keratohyalin granules. It is strongly cross-linked by disulfide bond which give mechanical and chemical resistance. Keratinization is two types: orthokeratinization and parakeratinization. The orthokeratized epithelium cells are filled with tonofilaments and there is total absence of nuclei and intracellular organelles. But in the parakeratinized epithelium tonofilaments are present but cells also show presence of pycnotic nuclei. Non-keratinized epithelium is differences from the keratinized epithelium in that it does not produce the cornified surface layer. The non-keratinized epithelium is made up of three layers: stratum basale, stratum intermedium, and stratum superficial. The basal cell layer resembles that of the keratinized epithelium. The cells of the stratum intermedium are larger than those of the stratum spinaceum. And their cell surfaces are more closely applied with a less prominent intercellular bridge and hence lack the prickly appearance. The granular layer is not present, and the cells above stratum intermedium lack keratohyalin granules and filaggrin and have less developed tonofilaments. The membrane-coating granules or oddland bodies are smaller than those of the keratinized epithelium. Stratum superficial. In this picture you can see stratum superficial. The cell is flat and contain nuclei. And also they contain less number of tonofilaments, lack of keratohyalin granules. Let's see what is non-keratinocytes. The cell of oral epithelium which contains the cytokeratin are called as keratinocytes, while those cells which do not contain this cytokeratin are called non-keratinocyte. First, the melanocytes. The melanocytes come from the neural crest and this are specifically presented the basal cell layer. This melanocytes are dendritic cells. If you can appreciate in this diagram, the brown long extension are the dendritic processes. This long processes extend between the keratinocytes. No, the melanocytes produces the melanin pigmentation. This melanin transferred through their dendritic process to the adjacent basal cell keratinocytes which store in the form of melanosomes. In this picture you can appreciate the melanophages. Melanin pigment dispersed in the connective tissue will be phagocytosed by the macrophages. The melanocytes appear as clear cells in hematoxylin section. It is detected by the dopperaction, silver staining techniques and Mosin-Fontana stain. Another non-keratinocytes are the Langerhans cell. Langerhans cell is a clear or dendritic cell derived from the bone marrow. These cells are found in stratum spinaceum and stratum granulosum. The typical structure of Langerhans cells show presence of convoluted nucleus and rod-like or tennis racket-shaped structure called as Birbeck granules. The last non-keratinocyte are Merkel cells. It also present in the basal layer, and it is described as pressure-sensitive receptor cell. It is responsive to the touch sensations. They are not show any dendritic processes. Ultrastructure of Merkel cells show deeply invaginated nucleus and numerous electron-dense granules. They are stained by Pa stain. Other cells, such as lymphocytes and polymorphonuclear leukocytes, are also found at various levels of the epithelium. They considered as non-keratinocytes. Dr. Dento. Promoting growth and professionalism.